Hello, everyone. Welcome to another episode of the Supply Unchained podcast. I'm Anzar Kamdar, your host for today. We have a very special guest today, Carmela Berlin. She's someone that's used to high reliability under very highly uncertain environments. Carmela spent nearly 2 decades in clinical and oncological pharmacy, as well as hospital and disaster relief operations. Carmela decided to switch careers. She attended the MIT Masters in Supply Chain program in Boston, as well as the Zaragoza Logistics Center in Spain. She is currently a supply chain practitioner at Partners in Health, an NGO. And one fun fact that I'm very jealous about, she's also a certified scuba dive master. Carmela, please introduce yourself to the audience.
Hi, everyone. My name is Carmela Berlin. I am a pharmacist in background, so I started my career as a retail pharmacist, actually, and I was in that environment for many years before I transitioned into clinical pharmacy. I worked in a cancer center as an oncology pharmacist for almost a couple of decades, as you'd mentioned. While I was a clinical pharmacist, I joined the disaster response team at the hospital. And I deployed with them. I started deploying with them in 2013 when Typhoon Haiyan hit the Philippines, which the country I was born in, and I decided to respond. And from that, I essentially realized that the role of supply chain is huge out on the field, especially. That's when I decided to go to formally study supply chain management, and so applied to MIT and Zaragoza Logistics Center, and here I am. Now I work for Partners in Health, and I support sourcing and procurement for a lot of country sites. I actually was briefly a scuba dive instructor. And at one point, you didn't know this, I was trying to find a place in an island so I could have a dive resort.
Carmela, you have a very unique profile. We've heard all this talk in the industry right now about AI co-pilots. We'll get to that later. But from where I stand, we seem to be forgetting the role of the experienced pilot. You have a very unique background, both operations focused and now in supply chain. You have experience as boots on the ground and in the front line, some very, very difficult and volatile environments. Can you tell us a bit more about your day to day and for the audience to understand some of the differences in the environments that you work in? I mean, you could also share quite a bit on your pharmacy side, but yeah, please.
Yeah, so my day to day is I support sourcing and procurement right now. And so I really try to create like I try to create a more resilient and like robust systems. At this point, I really am it's a hybrid of my clinical and the supply chain education that I just had. And now I'm practicing all of that all in one, right? So in trying to get stock to these different countries, there's definitely a lot of challenges. And realizing that the challenges are not just clinical, right? It's all about the whole systems operation. And I'll give you some examples from disaster response. I go in, when I respond to a disaster, I go into this country and we try to assess what is needed. What drew me into this is that I realized that patient care is not the only thing that matters, is that the whole systems matter, especially in uncertainty and low constraints. So when I deploy, for example, you could have the nurses are usually with me, the doctors are with me, you have clinical experts, but if you don't have medications, you don't have diagnostics, it just the system fails, right? So you do have to prepare. It is really like from end to end. And what stayed with me too is that trauma from all these disasters that I went to was not also the only thing that people need to deal with, right? It's that day-to-day lives. It's that disruption of where their food is coming from. It's disruption of where the medication's coming from. So we're not only trying to like help people that have injured, you also need to take care of people that have chronic problems. And that's really where I kind of kind of have to segue because when I was there, I used to have these kits, these WHO, they call it
Yes.
IEHK kits, and they're a kit that weighs about a little bit over a ton. They service 10,000 people, and so I get this huge kit, and I'm in a WHO Type 1 mobile medical unit. And so what we do is we go on these vans and boats and whatever to get to the remote places, and the doctors and nurses would treat patients and I would give them medications. But the point that I was making is this huge kit, I most of the time just take about 10%, 20% of it by the time we're done. And so most of it are, we either have to donate, take back, dispose. And so this is where I see all the trends of the supply chain, right? So if we dispose of it, we need to figure out how to do it because a lot of these medications you can't just throw in the garbage, right? So that's, you need to figure that out. If you're giving it to, if you're donating it to any hospitals, if they use it, that's great. If they don't use it, then they also have to figure out how to dispose of it. And in the meantime, you're creating this burden in their system. Their warehouse is probably not big enough to house all these. And so it's, that's another thing, the supply chain for disaster response kind of that you have to think of. And so one of the reasons why I decided to go into this master's program is that I had an idea and I proposed it as my thesis proposal to actually create a modular kit for a type 1 mobile medical unit where instead of taking this whole ton kit, we could actually, as like people that are deploying, would actually carry these boxes. They're going to be just big enough to have the necessity that's on there. And most importantly, is that they would have items for medications for chronic diseases. As chronic diseases in disruptions coming from disasters, they cause a long-term effect. And there's a lot of publications about that now. And so thinking then that all the stuff that I used to just give out are like high blood pressure medication, diabetes medication, asthma medication, and those things are just so important. And disruption of those would just really like compound into something
Yeah.
bigger towards the end. And so that's really funny enough. In 2024, the WHO came out with a modular kit for this. So they divided that huge kit into 10 modular units. So kind of just validated what I was thinking at that point. So it's very exciting for me.
So now I'm assuming you're using these kits. Was your original idea better or how they implemented it?
I think it was better.
Okay.
I think it was sort of like encompassing everything, but in a smaller, well, not everything in terms of trauma, but a lot more chronic disease medication. The other thing that mobile medical unit sometimes would do is that if the organization doesn't have that much money, so unless you have all the funds that you could be there, boots on the ground within 24 hours, a week from then, you're no longer treating trauma injuries. You're treating mental health. You're treating just disruption of medications. And so that's really what I was looking into because, yeah, you could use these kits for trauma right now if you're boots on the ground 24 hours. But a lot of times that's not the case for just any other NGO that would go in for disaster response because there's also like the country has to kind of get its own disaster response first, the country, the in system response. And then that's when they ask after if they can't handle that, then they would ask the WHO to step in if they need help. And then from there, you need to do an assessment and all kinds of steps before you actually get to go in to the country. And so with that, I was also thinking that if I was just going to deploy after a week, I don't want to go there, assess, and then order my medications. And this way, I was already prepared by actually bringing it in country. So I hope that makes sense.
Oh, of course, mind blown as far as just like the education that you unleashed here. But just in terms of certain ideas to unpack in there, right? One is essentially the coordination of, let's say, the first responders and what they need to do their job. Uh, we've spoken many times about different types of supply chains, like the quick, responsive ones, as well as ones that are needed for, as you mentioned, there's two aspects to it, right? The sensationalist view that everyone thinks about is okay, trauma victims, those images that reach out to you from an empathic perspective, but that's just one part of it. You essentially go there, you also have to set up the systems in place so the long-term disruption, some of the effects that you were talking about in terms of the disruption of usual medical care that's needed for long-term issues, that might be a second supply chain, I would say. But my question to you is how does it feel? Because I feel like you're juggling so many things. You go there, you treat the initial case, and then all of a sudden you have to manage what you're going to leave behind essentially and how those countries and those systems will adapt. We talked about all the layered systems necessary to address the crisis, but here's what I'm thinking. It's not just that you have to essentially build up a scaffolding in that moment to get the job done, but at the same time, perhaps leave something that could be sustained within those communities.
Oh, absolutely.
And I imagine that you prepare for all of these, but the ground realities are always different, right? You talked about when you get there, as you mentioned, sometimes the kids get there before you, or you get there and you're unable to do things. I'd
Right.
like to hear more about that.
No, it's definitely one thing that I've learned from this is also to kind of try to see how the different organizations work. And I think that to me, those organizations actually that prepare for demobilization and sustainability are the ones that are, I think, are worthwhile. It's like because you do have to think up to that point and further. You don't want to be that sort of like white savior to just go in, save the day,
Yep.
and leave, right? It's like what just happened. So these organizations, and I've worked for a lot of really good ones, really think about that sustainability. What's
Yep.
going to happen to these people? To a lot of times they would leave it with like some education and training towards the end and how to manage another response to the locals. But yeah, definitely that everyone needs to think about that, just the remnants of what you do after a disaster. And
I have a story about this.
oh, all right, go
So
for it.
I had like some NGO work as well, usually as part of my school, but also personally. So this comes to solar water pumps
Oh yeah.
installed in African countries. And this might have changed since 6 years ago when I looked up the statistic. 80% of those installed in Africa fail.
Oh,
And
yeah.
it's not because of a technical reason. They're supposed to work just fine. It's because of the lack of training and education for the people to maintain it after. And we were on this project where for a year they were waiting for the next batch because it was a German organization that sent students every year to install things. Great for marketing.
Mm.
But there was a year where one of the water tanks was not working. And all it needed a fix on was just a valve control because the tank was full and as a result the pump stopped and the valve was broken.
Right.
And again, someone already knew this there. It's just they weren't allowed to do anything about it because
Yeah.
so yeah, I know those cases where things don't work like that, but it's great to hear that like the amount of effort that goes into this. But let's maybe take a step back because when we previously spoke about some of the differences between humanitarian supply chains, commercial supply chains, at the same time, there's a lot of common factors as well, right? I think one of our previous podcasts, you might have seen it, was about bringing some of those techniques and tools towards humanitarian supply chains, which, in my opinion, are probably the hardest field based on what you've described. You essentially just have to go there, set up a supply chain, both locally, both globally, wait for parts. It's quite intense. So, my question to you is some of the examples of these challenges, as we mentioned, right? Coordination of personnel and equipment, the bureaucratic challenges, the regulatory challenges. lack of data and visibility. You mentioned end to end. The information uncertainty, that's probably the key part because you have to make decisions quickly. Of course, you can prepare as much as you want, but a plan is never holding up when you're faced with the reality. So, from my experience, what I felt is for such a supply chain as it's, let's say, taught at MIT, for something that's so multidisciplinary and cross functional, it's often disconnected from the actual operational ground realities. As in, some of these organizations and that are responsible for just bits and pieces, they're only pushing their metrics. Let's say those kits, for example. If 80% of that is going to waste or it's creating a burden, then great solution to make it modular, but at the same time, there is also this mindset, right? You're optimizing locally and you're not thinking from a system perspective.
Yeah, there's definitely a struggle to be able to get that perfect thing right. But as I mentioned earlier, this is full of uncertainty and just with low constraints, you have to make do with what you have. That's why I say preparation is the key. Just it really is the key. That's why for me that kit that I was trying to create was sort of like you have it on your hands, right? There's trauma kits like that they
Yeah.
have. It actually comes in a backpack, the TIS kit, but essentially that's for trauma. What I mean, so it's not really like something that you would. I mean, it's something that you could bring, but it's not as in the cases that I've been hasn't been needed as much. So it's really, but we definitely can use a lot of data to try to assess what is needed. But boots in the ground, a lot of times it really is not the same as what you pictured.
Yeah.
Everything's always different. And so that's when these practitioners, pharmacists, supply chain just really need to kind of take that in and learn from that. And there's definitely that like role in everyone to try to gather information. I was helping create a modular kit as well for PAHO. I worked with a lot of really great practitioners from South America and trying to create a mobile or modular kit for an operation theater. So it's just for uncertainty, right? You don't know what you really need. So we have these practitioners that says for a specific, like an ortho surgery, for example, this is what I need. And for this one I need. So those are all great. So I actually tried to look at the data, past data, what is needed, what medications were needed. I was trying to create this formulary and there was no data whatsoever. It was pathetic. Like I really couldn't find anything. I was like going with the MSF, like they had a list, but I was just some of the things I'm like, what? Like some of them didn't make sense. It was really hard to do that. And I think that's where the challenges are. And I think that's where all these new technologies can help. But at the same time, it really needs experience in it because you could only infer from the data, but there's that experience that you get from just doing something.
That's
And
a great way to put it. Carmela, you don't just, you have a very unique lens, as we mentioned, right? You are a doer, but at the same time, you have some very high level strategic insight. What have you realized, like, both about humanitarian and commercial supply chains in general that most people should be aware of?
that commercial and humanitarian supply chain, that they're really all similar in a way that you need to think systematically, end to end. That's really what it is. It's you need to kind of gather your information in the whole context. Like just try to really, because as in supply chain, you do something and then it could be great. And then all of a sudden down the line, it actually disturbs something else. So it's like you need to know that systems dynamics, just like, so really the context is what's needed and to look at it from end to end. Yeah, I think that's the commonality in those places. And also just to try to imagine the risks
Yep.
that is involved with anything because of that uncertainty. Because there's no perfect
You know,
thing in supply chain.
I mean, I think the pitch currently is that with enough data, we would be able to optimize it. But from my experience and definitely yours, in these sort of environments where data is hard to come by, there are a lot of decisions that you have to make based on available information, right? There's always going to be information uncertainty. Great point about the context. Carmela, we've seen, building on this point, we've seen an influx of promises and investment in supply chain technology. If you listen to all the marketing, you would imagine all the problems have been solved and we can declare victory. Yet, in my experience, I notice most companies are struggling with adoption, whether they're trying to build in house, buy off the shelf, or partner. I had a hard lesson as a techie almost a decade ago, realizing that just because something can be built, it's
Yeah.
going to struggle to solve the problem for end users. Could be due to adoption, it could be due to existing constraints in the process or the people themselves. We had a guest previously who's a great builder and who understands all of this. So, from a perspective of a builder, 80/20 rules, standardization versus customization, proper customer feedback loops, listening to your end users and your stakeholders, these can all help. Yet I keep coming back to the idea that in this push towards functioning co-pilots and agents, we seem to be removing agency from the people that are actually carrying out some of this work, like yourself. And we forget the role of the operator and the pilot themselves. And you've had some experience with AI tools yourself. Where do you think we're headed?
Oh, I definitely think they have a place.
Yeah.
They have a place to make our lives a little easier, but they can't go autopilot. They only as good as what we feed them. And I've been trying to create this program to kind of just do some optimization for all my analysis for like procurements. And as you can see, I usually do it for I usually do a cross site bulk order, four
Mm-hmm.
different countries where like a lot of vendors, a lot of vendors that does the bidding. And then I try to pick which one is the best, right? On the other hand, all their items are coming from different countries as well.
Yep.
And trying to optimize the shipping costs by trying to like consolidate things.
Mm-hmm.
And so trying to create this right now, actually, I'm doing it right now. So I'm having Claude help me with Python. I'm creating this program so I could use it for this analysis. And it's it takes so much context,
Yep.
and you can't give enough context to actually for it to spout out what you want, right?
Mm-hmm.
The numbers look great, the pages looks great, but it's not quite what you want. So
Yep.
it's really becoming better and better, but you always have to have that context.
You need the
And
underlying foundation and context of how things relate. Yeah.
exactly. And they could be your co-pilot. Like they could be right beside you to help you. But I think people underestimate the people that are actually doing the things, right? People on the ground, people that are managing things and their experiences. People are sometimes forgetting that. They just want to automate everything. So it's if you want data that actually matters, you need to have that context, and that could only be given by the practitioner.
Yep. Yeah, that's a great point, right? I brought up my previous podcast where we had a very forward looking builder as well as a practitioner. We talked about the generational transition in supply chain, and I think this is what's needed because we do have an influx of techies like myself from a decade ago that were just raring to go and saw all the technical solutions, yet you need to marry that with that domain expertise as well as just understanding what the context and the reality is. From your perspective, what do you think the ecosystem's missing? Is it, I'm not, you don't need to pick one. Is it the technology still needs work? Is it the talent? Is it the processes around it? Is it just our perspective and view on how those things should relate, for example?
I think it's all of no, I think technology is just getting better and better.
Yeah.
I think expertise out there is getting better too, but it's more of the linking everything
Hmm.
together to get that holistic view and to actually be able to do, as I'd mentioned, and I guess it keeps on coming up, the systems dynamics. It's end to end. And it was great for me to actually, with this formal education, to hear that it's just this systems thinking that everything relates to everything. And so I think what we're missing is just for more people to actually be able to link those together, for silos to kind of become like siloed, like departments to actually just come together somehow and to understand each other. Because a lot of the things there too is that they do their each of their jobs so well, but then there has to be a line where they meet each other.
Hmm.
And if a lot of times the animosity is that the other team doesn't understand what the other team does. And that so there's like that gap. And but what you need is someone that really understands from end to end to be able to like make operations work. It's just a systems
Again,
dynamic
I'm
again.
not going to pick any sides when it comes to this organizational struggle, I would say. But from my perspective, the people that need to get the job done from an operational perspective, the first responders like yourself, I feel they should have a bit more say because at least from a organizational perspective, what I've seen is that quite often the technology that we're being sold from a supply chain perspective ends up only optimizing its own metrics because it's
Mm.
disconnected. You brought up the word silos. It could be from a data perspective. We try to bring in that data, for example, from the endpoint itself, but then having to change the process around it as far as getting people on, let's say, a common operating picture seems to be very difficult in today's environment, just from my experience. I'm not sure what you think. You used the word animosity, so
Yeah, no, sometimes. No, but it really is. You're right. There's a lot of data out there, and it's what you do with that data that kind of matters, and how you actually interpret that data. You could have the best data, but if you're calculating it incorrectly from some point of view that another person doesn't understand,
okay.
it's
I know I was in a big corporate. I saw the same data being used for 100 different dashboards that said different things.
right. So it's that. So it's like, yeah, you want your KPIs, for example. It's like, so what are your categories to create that KPI? And you can't just pick, you kind of really have to define that problem, and end user being like whatever you're working on. So
Hmm.
it's really like the understanding of that really needs to happen before these technology can help you. As you'd mentioned earlier, like it could be the best technology ever, but then you go to a village in Africa, that's not going to matter. Like best computer or the solar pump, it could be the best in the market. If no one knows how to work it, it's not going to matter. So it's very similar to technology. It's really like you need to be able to define what you want and be able to also read and understand what AI could spout out at you, and try to figure out if that's what you want or not, if that's going to help you or not. So I think that all, yeah.
I think we're oftentimes getting distracted that we have quite often, most people, at least in our space, what I've noticed is supply chain tends to draw people that want some sort of impact, some sort of tangible impact, whether they're in humanitarian or otherwise. As you mentioned, there's a lot of waste, there's a lot of opportunities. If we just think about 80% of those kits going to waste, which could be diverted somewhere else, yet we tend to lose sight of the objective or the goal when we end up in these sort of fiefdom defending our KPIs to death with our own view of the data. What I am thinking specifically in context to the conversation we've had, why are we so unwilling to trust our first responders that need the supply chain to deliver to let them get their job done?
Repeat that again. Why are we so?
Unwilling to trust the signal from the people at the endpoint that need the supply chain to deliver to get their job done. Because again, we both know what supply chain can be. It could be beautiful, cross-functional, multidisciplinary, aware of systems dynamics and systems thinking, making sure things work perfectly. Yet the reality of most organizations, supply chain becomes essentially a cost-cutting function, quite often relegated to the back office and disconnected from operations. At least just from my experience.
Yeah. I guess it's not necessarily that that user or the practitioners don't get a whole lot of a say towards this. It's more like they weren't really the feedback. The feedback is not really that it's not usual. It's which I think is very necessary, right? For everything
Mm-hmm.
that you do, you kind of need that like feedback in order for you to assess whether something's working or not.
Yeah.
And for a lot of times, that feedback from the user to like from the end user to like whoever is creating this, it's not there. I think this was also from in humanitarian disaster response. In that context, I think it was just a lack of coordination. There's more coordination now than ever. Case in point, like in Haiti, when during the earthquake 2010, there was really lack of coordination on all the NGOs that came and helped and wanted to help, right? So it was chaos out there. Everyone just wanted to help. Everyone's there. The thing about disaster response is that resources are already constrained,
Yep.
right? And you, with your big heart, want to help. But if you go there without a plan, you're using that resources
Yep.
that is already constrained. Places that they could put unhoused people, you're going to be using because you need it. The fact that what happened was there was an influx of NGOs that just wanted to help. And at one point, there's data on this actually, there's a lot of amputation that wasn't necessary. It was a huge percentage. This is the reason why they created more processes for vetting these NGOs for being like a medical unit. So I think it's getting better. I think it was just technology wasn't quite as sophisticated then to actually be able to collect all these information. And
Mm-hmm.
not to mention, it's very transient, right? And people come and go like for these organizations as well. And so there's not that feedback to learn from it. And I think now we've learned that that data is also really important, but it's also hard to collect, right? It's like subjective trying to
Yep.
gather that data and do an assessment. So I think it's just challenging as a whole.
Do you have any advice for new practitioners or talent that wants to devote themselves specifically to humanitarian supply chains?
Oh, yeah, it's prepare for a tough job. Really understand the context. There's a lot of books out there. The Sphere Standard, for example, it's a book where it tells you sort of like the minimum things to give someone their dignity and humanity, minimum amount of water, and that kind of stuff. But it also shows you the coordination that happens when a disaster happens. Just learn about all the context of where you're going into, like countries that you're going into, because not everything is how it is in your own country. Like
Yep.
we all have this like ideals of where you're going, and it always will surprise you. Like it's different. It's like it's totally different. And also just the organization that I work for really does look into the global health and like public health, and not just like supporting hospitals or whatever, but it's totally the global health that a person, you could have medicine for for treatment for someone. But if they don't have food, I've done this, like going to the Philippines, for example, when there was like floods, everything was flooded. There was barely any food, right, for everyone. And someone giving ibuprofen, take this with food. That's what you say when you're at the pharmacy here. It's like, make sure to take it with food.
Yep.
And you just have to kind of think about it and say, wait, who are you talking to about this? Like, do they have food? Then maybe we should think about this first and think about this treatment and make sure they have food. You need to think about everything, like global health and just the context.
I mean, I feel like I could just keep asking you questions because I'm writing down notes, but the coordination of, let's say, food and medicine, different NGOs, you brought that up. It's quite a lot of work. Is there something, like a very quick question, if let's say AI was this magic ball, magic genie, is there something that you could like click your fingers and you have Elon Musk money that you could just change instantly?
Oh my gosh.
Or there's no simple solution like that.
Wow. Yeah, how like sometimes they're like, if I were to give you $1 million for 10 minutes, what would you get? Like, I
But this is to
struggle
fix
with
this problem.
that.
This is
So
just for the people deciding to come into this sphere because they need a moonshot, let's say.
I was gonna say to have this like little co-pilot that you could just like, I mean, it's sort of like AI right now, really, but it's like, well, actually, I do have one. So I've always had a problem with like, what's that? Not me personally, but I think there's a problem of getting data for wherever you're going by a disaster response. And there's organizations that are doing this now, but like what I was thinking in creating this project that I had was as soon as a disaster hit, I want all that information about that specific country, that specific area that was hit. I want morbidity, mortality rates. I want like all the demographics. I mean, I don't want to say I want all their personal information and like what they're taking, but it's like it would really help to
Yep.
have that like context of like what do I need to go there and help?
Diseases do I need to treat? What sort of medications?
Yeah,
Yeah.
yeah. So I think that would really be helpful for like an immediate response. And more disasters are happening these days. So it's that would be very helpful. It can help us with visibility, for example, with supply chains, help us with estimating forecasts and like it could do so much in terms of helping if you use it wisely.
Yep.
And if you use it with information already that this is not everything is correct. But also, yeah, ethically, just use it ethically because it definitely can create this like, I mean, there's wars all over now, and it could only, I
There's
think
certain
it's
aspects of our conversation that reminded me of the Tower of Babel example, as well as the
right,
idea of building together, shared
right,
ownership. Yeah.
shared ownership. And that's when in supply chain, which is in almost everything, it's like that everyone needs to build ethically, like the links in the chain needs to all help out each other and build to help out each other instead of building for like greed or hubris.
Yep.
It's yeah.
No, I mean, it's a great analogy. Carmela, thank you so much for joining us for Supply Unchained. It was very educational for me, also very inspiring and humbling. For our guests and our audience listening in, if they wanted to reach out to you, how would they get in contact?
This is so much fun. I could be reached via LinkedIn. It's just my name, Carmela Berlin.
See you next time.